So welcome to Module 3, I'm Dr. Was. In this module we'll be discussing the lower face, mainly the jawline and the chin. So looking at the jawline, this is a very popular treatment and more patients are asking for this. It's creating those kind of angles and enhancing beautification points that is taking more popularity with these treatments and has been popularized by celebrities. So knowing a little bit about the anatomy of the jawline is quite important. So just when we show you the model, we have the mandible, which is your jawbone. You have the ramus of the mandible, which is the vertical portion, and then the body of the mandible that comes across. On the corner, just where they both meet, right at the very bottom, that's your gonial angle, and that's the bit that we'll be augmenting to create that nice definition posteriorly. Now in younger patients, there's generally no problem with the mandibular septum, which runs all the way inferior to the mandible, and you can just put your placer filler right across all the way in towards the chin. In older patients, you'll find that there'll be a little bit of jowling, and that's where there's been a little bit of weakening of this ligament, so you'll have a little bit of a hammocking around here. So the key thing here is not to place any filler within the jowl itself, because that will just create the heaviness and make the appearance look worse. So going back to the gonial angle, this is probably the trickiest portion of the mandible to treat. Behind this portion here is your external parotid, which you can palpate, and anterior to the gonial angle is your parotid gland. So behind it is your parotid, anterior is your parotid. Now, your parotid gland you don't want to be injecting into, so your safe planes of injection here is deep, so onto the periosteum, usually with a needle, and that's onto layer 5, or into layer 2, which is a subcutaneous layer, and that's using a microcannula, and you can happily fill away through most of the jawline using the microcannula. So avoid that middle section where your parotid gland is. The next important part of the anatomy to be aware of is the facial artery. So if you just grit your teeth, you'll feel the border of your masseter muscle. Just anterior to that, you'll feel a little notch, and you might even feel a pulsation. Now that's where your facial artery passes through over the mandible and then traverses across the face. Important notes here is that you need to remain very superficial in layer 2 with your microcannula, so that you're always above the artery and never in the plane of which it sits. Otherwise you'll be looking at potentially an occlusion. So that's the anatomy that you're aware of. The techniques, just to recap, will be using a microcannula to go across the mandible, up the ramus, and using a needle, 27 or 20 or 30 gauge. I use a 27 because it's quite a thick product. If you're using extreme, just over the gonial angle, just to bulk out this little section. One point to note, in males the angle for the gonial is 90 degrees, so it's a little bit more sharp and square, and in females it's around about 110 to 120 degrees, so you've got more of a nice obtuse angle that gives that nice curvature.